Hey everyone, welcome to Caregiver School, the webinar series. This is a program to help you navigate your family caregiving journey. Now, these webinars are in addition to the material I cover in Caregiver School, which is an audio podcast training program that you can access. So think of the Caregiver School as the textbook to these webinar series. So you can access Caregiver School through the website, which I'll walk you through, but it's also available as a podcast, and you just search for Caregiver School. Now, just again, we'll make sure that we understand that I put my little disclaimer out here that I am not a lawyer, I am not a doctor, I am not a financial advisor. So I'm not giving you any legal, financial, or medical advice. I'm just giving you general information so that you can ask the appropriate questions to those subject matter experts. So let's get back started. So in the previous webinars, in the first one, we kind of covered becoming a caregiver, those first steps of knowing the journey that you're on, who you're caring for, and what your role is. And we also covered the 6 essential steps or tasks of being a caregiver. And again, the first one is understanding your role. Are you an overseer, a middleman, or a caregiver? And then we skipped to gathering information. And our second webinar was about focusing on the legal and financial documents that you need to start to gather and put in place. And then our last video, the third video, we focused on all things medical, understanding medical insurance, understanding how to navigate Medicare.gov and make sure you have the right kind of coverage, and also went in depth about medication management. And I showed you how to do a medication audit, kind of organize those medication systems. So we touched a little bit on organizing things. So I hope you've been gathering this paperwork, because one of our last videos will be on putting it all together and to organize it, but just start gathering these things. So you'll have gathered the legal and the financial stuff and all the medical stuff. So today we're gonna shift on sort of the day-to-day, the nuts and bolts of caregiving, and really the bulk of what Caregiver School is, which is just becoming just providing care. And that begins with evaluating the situation. And it's really important that you have a really good understanding of who you're caring for, what they can do, what they can do for themselves, and where they're going to need some help. And when you understand what kind of help that's needed, then you can make a plan. So let's skip back over to Caregiver School. I'm gonna jump over here to share my screen, and we're gonna come over here back to Caregiver School. So this is the student page of Caregiver School. And let me move this out of the way so that I can do that. Okay. So again, you come to caregiversschool.com, come to the student page, and this is where you can listen to all the lessons and also print out all of the worksheets. All of this is free. So how to pay for, let's start with, in doing the day-to-day, and this evaluation is like, what care is needed, who and where the care will be provided, and how and who will pay for it all. So we're going to jump to how and who we're going to pay for it all, but we're going to come to back up to the legal and the financial checklist. In that previous video, we focused mostly on the legal documentation, getting your advance directives in there. But in here, I have a checklist of all the financial things to be thinking about and information to be gathering. And this is where you're going to figure out how you're going to pay for it, all the sources of income, whether there's actual income benefits or if there is insurance that would pay for some of these cares, long-term care. So your first step in figuring out who's going to pay for it all is in caregiving is, what resources do you have to pay for care? You know, what are you working with? All right. Make sure you look, you research veterans benefits and also long-term care policies, and some life insurance policies will have a financial, you can take some money out of it to pay for care. So now let's focus on what care is needed, okay? And here under Caregiver School, this would be all of part 2 of Caregiver School. And where I want to start with is when you're trying to figure out what kind of what care is needed, then really one of the first things that people worry about is is their cognitive ability, because if you're dealing with, again, coming back to those 4 journeys, who you caring for, sometimes it's difficult for people to separate, well, is this just normal aging, or is this the onset of dementia? So in this lesson of Caregiver School, when I talk about driving, I really am focusing on normal aging. So if you look at that worksheet, when driving becomes a problem, I just talk about separating what normal aging affects our vision, our reaction time, and some cognitive ability. And but when it crosses over into something more broad, more challenging, like a dementia. So now dementia is a broad category that just means brain impairment, cognitive impairment. And there are lots of causes of cognitive impairment. So one of the things, if you're concerned about your loved one having any kind of cognitive impairment, the place to go to then is to the Alzheimer's Association. And in the Alzheimer's Association, they've got lots of information about understanding, where did I put this? So understanding what is Alzheimer's disease, what is dementia, the difference between Alzheimer's and dementia. But a lot of this, it just gives you basic information to understand what should you be looking for if you have any concerns about it. So even if your loved one ends up not actually having specifically Alzheimer's, but is having some sort of cognitive impairment, the Alzheimer's Association is a great resource, sort of get some information about that. So as you're evaluating your loved one's abilities, their cognitive ability is something you're gonna really want to be assessing. So let's come back to Caregiver School. Sorry, I keep jumping around. And in Caregiver School, in part 2, I have this very detailed form of how to conduct an initial assessment. So this would be just walking through all levels of physical functioning and home safety and all aspects of the initial assessment. And what you're going to want to look at is, are they independent? They don't need any assistance. Do they need some, mostly unaided? Usually needs help, always needs help, unable to do independently. So this is what you're going to use to evaluate your loved one's situation. So when to have a good understanding of what their care needs are, you've got to see what can they do right now and what do they need help with. And then the next question you're going to want to do is make a plan, and come back to Caregiver School here. Let me see, where is the make a plan? And then here is the plan of care checklist. So what are the current needs? Plan A. What is the current needs? What's happening? What needs to be done now? By whom? When? Who pays for it? And when? And this just, once you understand what the needs are, then you can really think about, okay, how are we going to do this? And plan. I want everybody to have a plan A, which is what's working right now. Plan B, which is anticipating, the normal changes that will happen. And when do you think that will happen? And how will we know that it's time to make a change? And plan C is that crisis plan. What do you do if things don't go according to plan, or we have some tragic event? Okay. So as you are putting a plan together, one of the things, so you've evaluated you know, what care is needed, and then and now you have to figure out, okay, where will that care be provided and by whom? And there's a big um, uh, difference between, does your loved one just need residential or custodial care? They just need someone to help them day to day with some of those activities of daily living. Or do they need more skilled medical care? And so in your evaluation, so someone with Alzheimer's will need more custodial care, making sure that they're safe and that they're being taken care of, and but very little medical care, because it doesn't really impact their physical body other than their brain and their cognitive functioning. Where someone who has a cancer or a congestive heart failure or some other medical condition might need more medical care. So understanding if you need just residential care or more medical care, and a lot of times they kind of cross over. Okay. So now where can that care be provided? All right. So there are lots of options. You need to look at the location, and not only the location of where it is, but the level of care. And that level of care ties back into, is it medical care or is it custodial care? So think when we look at levels of care, there's independent, there's assisted, and there's skilled. Okay. Independent basically means really not a lot of assistance. Someone is living independently, they're preparing their own meals, they're putting, they're taking care of all their activities of daily living. Maybe they need help with, some chores or things that are physically too demanding, or a little bit too overwhelming. Maybe you're helping them with manage their medications or help paying their bills, but for the most part, they're living independently. Okay. And maybe someone is just going in and helping out every now and then with some chores. And that can be either in their own home, it can be in an apartment, or in someone else's home. So that would be called independent living. Now, assisted living is when someone needs more assistance. So in that evaluation, they would be more of a 2 or a 3. Okay. Under this, let me come back to that evaluation. And this assessment. So here, independent, no assistance. Minor assistance, probably someone could live independently, mostly unaided. Even moderate assistance, there are people that can live independently, but have someone checking in on them all the time about certain things, maybe about paying bills or home maintenance or things like that. 3 or 4 is leading more into assisted living. Okay, where there's some assistance that's needed, whether they can still live independently and someone is coming into the home to help, or if they need to be in a facility where they need a little bit more help. Okay. So assisted living is it can be done 2 ways. It can be done in a person's home, where care is brought into the home to offer the assistance, and whether they're there just for a few hours every day or overnight or constantly, or if they're in a facility, an assisted living facility. And an assisted living facility is primarily custodial care. It is not medical care. All right. And if you're looking for an assisted living facility, not all assisted living facilities have medical care. So you're going to want to ask if your loved one has more medical needs. You're going to want to know, the questions you'll want to ask is there a nurse or an LPN or some medical person that's available to oversee some care? All right. Now, the higher the skill level, the higher the cost. So just someone that's custodial care really just needs a companion, just, just a personal assistant, just somebody, someone from your neighborhood, someone that's untrained, can come in and provide some assistance. And then as there is more of a skill needed, then you're going to want to look for someone that has some sort of training or certification. This will be especially important if the assistance that your loved one needs requires any kind of physical assistance. So getting someone up in and out of a shower or up and out of a bed where they're going to be lifting them and physically moving them, you're going to want to make sure that they are trained and know how to do that without hurting themselves or your loved one or both. Okay. So the more skill that your loved one in assessing their needs, the higher the skill that they need, then you're going to want to look for more skilled help. And in caregiver school, I go through all the different classifications of a personal care assistant or a home health or a home aide versus a certified nursing assistant versus a licensed practical nurse. So we go through all of that through caregiver school. But generally, assisted living has sort of the lower end of that skill level. It might go as high as a certified nursing assistant, and that's someone that can help with transfers. And some of them are qualified or trained or certified to manage medications and administer medications. And that's a big one, because if you have someone with dementia and so think of giving medications. It's one thing for someone to say, here you go, Mary, here's your medication, and Mary can take them herself, is very different than someone with Alzheimer's, where there might be a little bit more active involvement in administering medications, giving shots or administering medications. So again, there's a fine line, and you want to make sure that the person that you are hiring, if you have to hire this help, is trained and certified and knows how to provide that kind of care. So assisted living facilities generally have 24 hours of low level or assisted care, and can go up higher. You'll want to do some research on finding some good facilities in your neighborhood, in your area. There are lots of, switching over, sorry, as I'm talking, as I'm trying to switch over to, so AARP, AARP.org has a wonderful set of resources. You come here to family caregiving, and they have all kinds of tremendous amount of information on family caregiving and caregiving. I think where's the drop down menu? Care at home, nursing home basics, local resources, all kinds of great articles and information on home safety and all kinds of things to help you make some decision, assembling a care team. And this is kind of what I'm talking about, what level of care you need, all kinds of things. All right. And so this would be a great resource. I believe also in this website, they have a way that you could search for care in your area. There's a great, it's a for-profit. I don't usually recommend specifically for-profit companies, because I always prefer that people go to the .org or the .gov sites to get some independent information. But A Place for Mom, and I'm sure there are other services, help families find caregiving facilities in their area. They usually are free for the family caregiver. They're usually free for the family, the services, and they get paid by the facilities, which means that only the facilities that participate, that service will show you only those facilities. But they do give you a lot of things to look for and questions to ask. So they're great. They're great resources. But you can come in AARP, and even Alzheimer's, the Alzheimer's Association has ways to search for care facilities in your area. Okay. PACE is a Medicare program. It's the Program for All-Inclusive Care for the Elderly, PACE, and it's a Medicare program that provides, it's for people who are primarily home, and they provide sort of day support. So it's it's a little bit more than what an adult care center. We've heard of places where you can send your loved one, can go for the day and just have some socialization and some activities, and get some just a day support program. PACE also combines all the medical care, and so that's something to look at. You'll want to go to medicare.gov to get information about the PACE program. So, and then the highest level of nursing, of caregiving, would be the skilled care, and these are 24-hour facilities. We think of nursing homes is what they're called, but they're skilled nursing facilities. They have an RN 24 hours a day. All of the staff there are certified nursing assistants or higher LPNs. They have a medical director that's available. They administer medications. And so many people need that level of custodial care because they're so physically impaired. They need that level of custodial care and not necessarily that level of medical care, but they do need that level of skill. All right. And we talked about in the previous video about how to pay for that, and through private funds or Medicaid. All right. So independent, assisted, and skilled nursing. And then where that's provided, independent can be in the individual's home or a private home or an apartment, or with family but living independently. Assistant could be in a facility, but it also could be in your own home and you're bringing in the assistants, or you're the providing the assistant, right? And then full-time custodial care would be skilled nursing care. So, so as you're deciding, what care is needed, and then where will that care be provided? Then you're going to decide who, and are you going to provide? Is family going to provide that, or are you going to hire that? So those are really difficult conversations. I have a whole section on family meetings and having conversations all around this issue to make sure that you are sharing the burden. So usually there's just a primary caregiver for our loved one, but to involve other family members and to delegate some tasks and get some help and support. So now one of the other things is now where can you go for help? And that would be another important thing to add to your now that you know what care is needed and where you're going to provide that care. Now, how do you find some resources? In Caregiver School, I have a whole section on resources. And these are all the different, I refer to these throughout all of these videos. So I have the resources that coincide with the lesson. And so you want to print this off. And these are websites. All the resources that I provide are general, that you can access just generally anywhere. But you'll want to use some of these, like the Meals on Wheels, to find your local Meals on Wheels program, to find your area on aging that has community-based resources. So you'll want to find out, now that you know what kind of care is needed, well, what are some of the resources that are local, just within sort of the immediate family, what can they do, or your immediate community, maybe church or neighbors. And then there are community-based ones. They're provided for, usually the area on aging covers several, like a large geographic region. And then there are national resources, all right? So you're going to start to want to gather a list of people and resources that are going to be available for your caregiving journey. And then finally, in what we'll cover today is self-care. And it's really important that when you are caring for someone, that you take care of yourself. And that is task 6. And it's not, I've listed it as the last task, but it is not the last task. It's something you need to do throughout your caregiving journey, is to understand how the stress and the grief and the sadness and the worry and the anxiety and the frustration of being a family caregiver will take a toll on you, and to make sure that you are caring for yourself as much as you are caring for your loved one. So caring for the caregiver is an essential part of your job. So in these videos, we've talked about the 6 essential tasks of family caregiving. We've so far covered knowing your role. We've talked about evaluating the situation and then making a plan. We've talked about gathering information, and we've talked about making sure that you take care of yourself and caring for the caregiver. And in our last and final video, I'm going to show you an organizing system, how to pull all of this information, all of these resources, all of this stuff together into a simple organizing system so that you have it all in one place and easily accessible. Because again, coming back to caring for that caregiver, stress is the biggest thing. And if you can't find what you need, or you feel overwhelmed by all the paperwork and tasks, keeping it organized will kind of help eliminate some of that, hopefully eliminate some of that stress. So I hope you found this helpful, and I look forward to our next video. And until then, take care of yourself and know that there is help for the journey. Take care.